Hi, friends. So now coming to the next benign tumor, that is chondroblastoma. So, like I said, the benign tumors are divided into uh, locally aggressive and rarely metastasizing. So this is an intermediate grade. In my in the bone classification, if you see, normally we had the concept that there is one benign etiology and then there is one malignant etiology. But over the time, we have realized that there are certain types which may remain very indolent, will not change over the time, versus certain tumors like giant cell tumor, aneurysmal bone cyst, chondroblastoma, which though benign but continue to destroy the body, the different parts. And some of the tumors like giant cell tumors also metastasize. So WHO classification in 2013, they made it into an intermediate grade also. So which are the tumors that fit in intermediate grade? Two types. One, rarely metastasizing, and the other types were locally aggressive. Like your locally aggressive, I would say ABC, rarely metastasizing GCT, and chondroblastoma is one of them. So with this background, let's start. So today in this topic, we are going to learn about the clinical features, basic diagnostic workup. Already it must be repeated many times. What specific some pathologies? I know you're good at orthopedic surgeries, but a little bit of pathology is important so that when you read the reports, you should know what you are dealing with. And the treatment options with some recent advance. So, the classical definition of chondroblastoma is epiphyseal lesion in an immature skeleton. So what are the other names? It is also known by the name of Codman's tumor. As such, there is a Codman's triangle also. There's so many other entities. It is primarily a locally aggressive type of lesion, which has a tendency to metastasize. It is rare, commonly less than 1% of all tumors. Now here, what do you see in this X-ray? You see, this is, if you have to read the X-ray, this looks like a immature skeleton. Probably it's maturing somewhere around 18. You can see the physeal line. And you see a radiolucent zone which is there in the epiphysis. So there is the pathology which is present in the epiphysis. And if you see, the boundaries are well demarcated and it is well localized. The matrix here doesn't seem, probably some little bit of sclerosis, what we are seeing in between. But as such, the matrix looks a little bit of calcified, you see here, or ossified, what you can say. Zone of transition is narrow. Probably cortical breach, not appreciated in this. No periostal reaction. This looks all intraosseous. There's nothing on the outside. So this is a classical description of chondroblastoma. So primarily it starts in epiphysis and slowly, once it crosses the physeal line, it may go towards the metaphysis. So in your exam, or in your practice, if you see any lesion in which is epiphyseal, immature skeleton, the first differential is your chondroblastoma. A similar lesion, if you see in an adult mature skeleton, then you may have many other differentials like giant cell tumor, which is the most common, then aneurysmal bone cyst, like that. So this is briefly about it.